Antibody testing is giving us a better idea of how many people have or have had COVID-19. NBC4's Annette Audela looked at results from a testing center in Baldwin Hills. She has more on what those numbers are telling us.
It was just over 2,000 people from the Baldwin Hills Crenshaw area that were tested a couple of weeks ago. On your screen, a breakdown of the results by race and ethnicity. A quarter of the residents tested were Caucasian. Their positivity rate 8%. Close to half of the patients were Hispanic or Latino. Their positivity rate was 13%. Now, Native Americans only represented 3% of those tested, but had the highest positive results for COVID antibodies. And the biggest surprise was with the African American population. Their positivity rate at less than 3%, which health officials say is much lower when compared to the national average. Now, doctors point out that minority and underserved communities have been diligent in following the health guidelines, but continue to be at a greater risk for contracting the virus because of the service jobs that they're employed in. Many of them are essential workers. They also have less access to health care, and they tend to have other underlying health issues. But the good news, according to medical officials, the data collected from these results suggests that we may be getting closer to herd immunity. They pointed to a recent medical paper that contradicts the initial research that says that people with COVID who have mild or no symptoms are highly infectious.
There are a lot of asymptomatic people in the population that have developed antibodies and are resistant to it. There are also a significant number of people who have T-cell immunity, which means that they may not develop antibodies, but the virus can't jump from person to person.
Doctors also pointed out that people who test positive for antibodies don't need to quarantine because the test itself does not determine whether a person is currently infected, but it does reveal whether they contracted the virus in the past. They also mentioned that it's unlikely that you can get COVID-19 twice. And for those with antibodies, doctors say they are at a slight advantage, knowing that they may not have further complications, but should practice the same safe behavior as others who are at the same risk of becoming ill. We'll send it back to you in the studio.